Hello, everyone, and thank you for joining us today for the Health Reform Beyond the Basics COVID-19 Town Hall. We hope you're all doing well during these trying times. My name is Ina Rubin, and Beyond the Basics is a project of the Center on Budget and Policy Priorities. It's designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We are a nonprofit policy organization and are not a part of the U.S. Department of Health and Human Services. Beyond the Basics is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. This town hall is not intended for press purposes. After the town hall, we'll circulate the slides and some additional resources. All participants are muted and in listen-only mode. If you'd like to ask a question, you can either click on the raise hand icon at the bottom of your screen and we'll unmute you so you can ask your question, or you can click on the Q&A icon and type your question into the box. We'll be taking questions during the second half of the town hall. We may not be able to answer every question asked, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. You can also email your questions during or after the webinar to beyondthebasics@cbpp.org. This town hall will be an open forum for questions about eligibility and enrollment in the marketplace coverage in light of the COVID-19 pandemic and recent federal legislation meant to address it. We'll begin the town hall with presentations from Sarah Lueck, Tara Straw, and Shelby Gonzales, who will provide a brief overview of current marketplace enrollment options, special enrollment periods, stimulus payment and unemployment income counting guidelines, and navigating coverage for immigrants and their families. Now we'll turn it over to Sarah Lueck, Senior Policy Analyst here at the Center on Budget and Policy Priorities, to begin the presentation.
There we go. Hi, everybody. Glad to be here with you today. Just to start out a bit on special enrollment periods, you may already know this, but that is the term for how people can actually enroll in coverage in the marketplace. Could you back that up? Sorry. How people actually enroll in the marketplace when it's not an open enrollment period. There's the annual open enrollment period every fall when people can sign up for coverage the following year. But the special enrollment period means that the person has experienced some kind of event or situation during the course of the year outside of open enrollment, and that lets them get access to a marketplace plan, which of course they need in order to access premium tax credits and cost sharing reductions if they are eligible. So these are very important right now. I'm going to be focusing in my remarks about SEPs on the situation in the federal marketplace states, and those are and any state that uses a healthcare.gov enrollment platform. States that have their own state-based marketplaces will have different situations. In fact, nearly all of them have an emergency temporary COVID-19 focused enrollment period going on right now. So if you're in one of those states, that's actually quite an easy way for lots of folks that need coverage to access it, including the uninsured, and without a lot of the sort of strings and bells and whistles that I'm going to be talking about. So this is really about the majority of states where people have healthcare.gov as their marketplace. All right, next slide, please. Thank you. So just a few tips and general reminders that are kind of important to remember at this time. I think first of all, just note that Medicaid and the Children's Health Program don't require anybody to have a special enrollment period, so they don't need to have any special circumstances other than they're eligible for those programs. And it may be the case right now where if someone isn't getting any income, they're most likely for that month, they're most likely eligible for Medicaid. So there may be many more folks that think they're eligible for marketplace coverage, but actually are eligible for Medicaid. And then in that case, it's simpler in some ways and no SEP is needed. As I mentioned, healthcare.gov does not have an emergency SEP for COVID-19. There was some talk a little while ago, a few weeks ago, that there might be one coming from the federal government, but that has not happened. We don't foresee it happening right now. We haven't heard that that will happen. So I think the most important thing is probably to focus a little bit and think a little bit about the SEPs that do exist in the marketplace. And we're going to be talking about a few of the really important ones today. because those are SEPs that in a lot of cases, folks that are dealing with challenges like losing their jobs, their health coverage at their jobs, they're going to be able to qualify for a marketplace plan under other SEPs. So it's important to tune into what those are. The most relevant one is probably the loss of other coverage. So mostly those folks who are losing their jobs and losing their health insurance, both would be candidates for this SEP. And we're going to talk a little bit more in detail about that SEP and how it works. But just also so that you're aware, there are a variety of other life events, many different situations where SEPs may be triggered, and people might be having those situations even amid this crisis. So someone has a baby, if they move to a new area, even within their state, they may be able to qualify for an SEP if they get married. So it's useful to think about when folks need coverage that there might be other events going on in their lives that would be relevant. And it's also good to remember with SEPs that they're usually triggered when a person or their family member, and when we say dependent here, we don't mean tax dependent, we mean health coverage dependent. So a person eligible to enroll in their plan with them, which would usually be a spouse or a child, those folks are considered part of the SEP group. So if one of those people has the event that triggers an SEP, that may often bring along the other family members that can enroll in coverage with that person. So it might be a way into marketplace coverage for people that you wouldn't have thought about and people who are not tax dependent of the person. As far as the process for SEPs, they do tend to be quite complicated, but we want to not discourage people in the current environment. People who apply for an SEP may get asked for documents to verify that they're eligible for that SEP. They may be asked to provide paperwork within 30 days in order to get their coverage made effective. But in hearing from folks, the sisters that are working out there in the real world, we're getting some mixed reports about whether those requests are coming as frequently as before. Some people are saying yes, we're getting those requests for documents, and others are finding no. So I think the advice that we would give is go ahead and apply for the SEP, and don't worry too much if you don't have the paperwork, and just try your best to get the folks through with the coverage and see how the process works. And then you can see on the slide at the very bottom, if someone's asked for documents and doesn't have them, which is a situation you could imagine happening if I've lost my job-based health plan and I'm not in my office, I may not have a piece of paper that says that I'm losing that coverage, when I'm losing that coverage. That's the sort of paperwork that people have been asked for. So if people don't have that paperwork, the prudent thing to probably do is to submit an explanation letter to healthcare.gov, and the marketplace has its own template letter, which you can see linked to there. That would be a good way to sort of cover that base. If people don't have documents and they're not going to easily get them or be able to get them in time to qualify for the SEP, we don't want that to be a barrier. As much as possible, we want people to get through the process. Next slide, please. Thank you. So I mentioned the loss of other coverage. Often it'll be employer coverage that a person is losing at this point in time, but the loss of coverage is really a umbrella term for lots of different situations. And so don't get narrowly focused too much on that, because it could be a lot of different situations that will qualify for that SEP. So it would be the person losing the health plan from their job because they quit, because they were fired, because they were laid off, or even if their work hours reduced and they were just no longer eligible for their employer plan anymore. So that's important to know. That's a wide array of situations. Of course, it would also include, this marketplace SEP would be available to folks who lose their Medicaid coverage, who lose children's health insurance, CHIP, or who lose a student health plan, which could be something that's happening right now, potentially, if people are leaving school. It also includes when an insurer or an employer cancels a health plan. So maybe they're just taking that action. That would be a loss of coverage as well. Loss of coverage does not include cases where the individual, the enrollee in the plan, just stops paying their premiums or voluntarily, calls up the insurer and says, I don't want to be in this plan anymore. It really includes those situations where they're losing eligibility and losing the coverage really through no choice of their own. Another SEP event that may become relevant right now is if a person is enrolled in an employer plan and they become newly eligible for premium tax credits. So this could be, as you probably know, if folks have an offer of coverage that's technically affordable and technically comprehensive enough under the federal government rules, they're not going to be eligible for premium tax credits. So if that situation changes and their employer either reduces the premium contributions that they're providing to that person so that it's no longer affordable to them anymore, or if the employer cuts back on benefits under the plan, so the coverage changes in some substantive ways that make it no longer comprehensive, that would mean that the person doesn't have an employer plan that bars them from getting the PTC anymore, the premium tax credit. So if that happens, as employers are maybe changing their coverage to their employees, that would be a trigger for an SEP that someone could then go to the marketplace and get coverage and get the premium tax credit that they're newly eligible for. And then another one that I'll mention is moving out of the Medicaid coverage gap. So this is an SEP that exists. It is for folks who were previously ineligible for Medicaid because they were living in a state that did not expand Medicaid under the ACA, and then experience an income increase to a level above the poverty line, and then become newly eligible for PTC. So if they have that experience, that would be a reason to access coverage. They could get an SEP in the marketplace. It's a situation that it might sound a little counterintuitive, but there are folks that are going to be getting unemployment insurance payments that are significant at this time, and it may be that there will be cases where people's income increases to the point where they're over the poverty line and then able to get an SEP. It's also important to remember that this isn't just that they currently live in a non-expansion state, it's also you're eligible for this if you lived in a non-expansion state before, during the last open enrollment period, and you were not able to get coverage because of that. Next slide. Another important issue that is going to come to the forefront for some folks is this choice between COBRA and marketplace plans. COBRA is the opportunity that many people get when they lose their job to continue their job-based coverage, but typically paying the full premium cost themselves. So this is an important moment if folks are losing their jobs to make this decision about, do I go to COBRA or do I go to the marketplace plan? It's important to know that the offer of COBRA from the employer does not make the person ineligible for premium tax credits. They can get premium tax credits if they choose to go to the marketplace, but they can't take COBRA and keep COBRA and get a premium tax credit. So that's an important moment in time to think about what might be affordable for them. If the person enrolls in COBRA, they cannot change their mind and move to the marketplace once their 60-day marketplace special enrollment period has ended, right? So the loss of the job-based health plan triggers an opportunity to get COBRA or an opportunity to get into the marketplace. If the person chooses the COBRA and it's still 60 days, they're still within their 60-day SEP window for the marketplace, they can choose to get out of COBRA and get into the marketplace using an SEP. But if the 60-day period is up, they're not going to get access to a marketplace plan because they lost their coverage. It's just a deadline that exists in the rules. So I think this is just the bottom line is people should think carefully at the moment that they lose job-based coverage, if possible, to decide whether they're better off going on the marketplace with a premium tax credit at that point or in COBRA. If they've made a mistake, for example, and they decide COBRA isn't affordable and they didn't really maybe realize what they were doing when they signed up for it, there is still that opportunity for them if they're within their 60 days from losing their coverage to make a change and go into the marketplace and get a premium. Next slide, please. So of course, I gave a very light touch on a few SEPs and mentioned there's a lot of other events that might trigger an SEP in the marketplace. So this is just a chart that we've put together that is a good reference. If you're dealing with somebody and you're trying to figure out if they have had an event that triggers an SEP, this will be a way to kind of go through and see if any of the situations will fit. And there's a lot of details on there, such as whether the person needs to have had prior coverage in order to qualify for a particular SEP. So that's important information to have too. And with that, I think I'm turning it back over to Tara Straw to talk about income counting and premium tax credits. Back to you, Tara.
Thank you, Sarah. Now we're going to talk about income counting for Medicaid and CHIP and for APTC. There were some changes in the law that, one, provided stimulus payments for many people who are low and moderate income, and second, providing additional unemployment insurance, which we'll get to next. So first, the stimulus payment, it's $1,200 per adult and $500 per dependent child for low and moderate income families. This is not included in income for any purpose, including for Medicaid, CHIP, or APTC determinations. And we have there at the bottom the citation for this because some people have been asking. Some Medicaid agencies may have it wrong right now. So that's where you can direct them to if your agencies are not appropriately accounting for or disregarding the $1,200 per adult and $500 per dependent child. So it should not be reported on any application for assistance. Next, we're going to dive into unemployment insurance. Now, this is a bear of a slide, but what I want you to get from it is just a couple of basic points. So first, the CARES Act took a number of steps to improve and expand unemployment insurance. So normally, in most states, the people are eligible for unemployment for up to 26 weeks. You can see that on the map on the right. But the CARES Act extended that by an extra 13 weeks. And so most people will be eligible for up to 39 weeks of unemployment insurance. It also extended unemployment to other people who wouldn't normally be eligible, like self-employed people and gig workers. So most people will be eligible for unemployment now. As you know, regular unemployment insurance is counted in income, and that has always been the case. Healthcare.gov asks about that specifically. The extension of unemployment up to 39 weeks and the expansion of unemployment insurance to new populations is counted in income. That benefit ends December 31st, 2020, unless Congress chooses to extend it. But there's an additional $600 per week supplemental UI benefit, and this ends July 31st. This has a complicated treatment. So it does count for APTC eligibility determinations. You have to add in that $600 a week in federal supplemental UI benefit, but it does not count for Medicaid and CHIP eligibility determinations. So you would ignore the $600 per week benefit. The problem is that eligibility determination systems are just not ready to perform this calculation. We have not heard of any system so far that is ready to go on this one. And although I'm sure that many systems are trying to figure this out. Healthcare.gov is still trying to figure this out, and I'm sure the state-based exchanges are as well. So let's talk a little bit more about how you estimate income for someone who is unemployed, because this is really tricky, and this involves a crystal ball, as many income projections do, but this one is especially hard. So I like to think of it as putting income in buckets. So for a family with a person who is unemployed, first I'm going to look at their pre-UI income. So what did they make up until they became unemployed? Then to calculate their unemployment income, you can ask a couple of questions. So first of all, you're going to want to know, what is your weekly base UI benefit? So what is the state amount? before you take into account any other kind of federal expansion. And then you can ask, how many weeks will you receive the UI base amount? Now, of course, this is a big guesstimate because many people plan to or hope to go back to work. But if someone just doesn't think that they have prospects and are pessimistic for the year, you can count up to 39 weeks of their base unemployment. Finally, you're going to add the $600 a week, but only up until July 31st. And you're going to do this for the APTC calculation only, and you'll ignore this amount for Medicaid. And then you need to add any other MAGI income, just like you would for any eligibility determination. So you can see what it looks like. There are a couple of ways to think about the $600 a week and the UI base amount. So here I've just illustrated if you think about before and after July 31st, because July 31st is when the $600 a week ends. So even if someone starts getting unemployment in June, they still only have up until July 31st. So it's important to keep that in mind and not be overly inclusive of the $600 a week. So we're going to look at this through a couple of examples, which will show you how this calculation really changes eligibility. Damon and Sarah are married and live in a Medicaid expansion state. Damon earned $5,000 prior to April 1st when he lost his job. He filed for unemployment. His base benefit is $300 per week. He receives an additional $600 per week, which is not counted because we're looking first at a Medicaid eligibility determination. Just like we would any other time, you start with Medicaid eligibility and then you look at APTC eligibility if they aren't eligible for Medicaid. So he receives a total of $900 per week, the base amount plus the $600 up until July 31st. And then he anticipates only getting the $300 per week for up to 39, for a total of up to 39 weeks. Sarah projects earning $12,000 for the year and they have no other income. So the first thing we're going to do is a Medicaid analysis. Now remember, Medicaid is based on monthly income, so that's yet another wrinkle in this. His monthly UI income is $300, the base rate, times 4.33, which is considered a month, and that is just about $1,300. You'll add to that Sarah's monthly MAGI income of $1,000, and they have nothing else to add. And so when you do the math here, you find that they have a Medicaid MAGI of 160% of FPL. So they are not eligible for Medicaid because their income exceeds 138% of FPL. Now, I will say one additional wrinkle here, which is Medicaid at this point in the year, since we have the federal poverty line calculations for 2020, Medicaid uses those calculations, whereas remember, for the purpose of the premium tax credit, we're still using 2019 FPL levels. So keep that in mind too when you're trying to do the math on this. Now we're going to look at exactly the same facts. So they get exactly the same amount in pocket. We haven't changed anything about the facts, but since they're not eligible for Medicaid, we're going to do an APTC analysis. So first, we're going to spell out the pre-UI income of $5,000. The UI income before July 31st is $15,300 because we're including that $600 per week for 17 weeks. The UI income after July 31st is $6,600, and then Damon is not anticipating any post-UI income. And then we add Sarah's income of $12,000 for the year, and the total is $38,900. This is 230% of the poverty line, and so they're eligible for APTC. But you can see the huge gulf between their Medicaid determination percentage of the poverty line versus their APTC determination. We're going to look at one more example, and this is for people who are in the who are in states that have not expanded Medicaid. At the start of the year, Mike, who lives in a state that didn't expand Medicaid, is in the coverage gap. So he earned $2,000 prior to April 1st when he lost his job. He files for unemployment. In his state, his base benefit based on his previous salary is going to be $240 per week. He anticipates getting unemployment for 39 weeks. First, we're going to do the Medicaid analysis. We're looking at monthly income. So we'll take 240 times 4.33, and we'll get an income that is roughly 98% of the FPL. So he is ineligible for Medicaid because he just barely gets under 100% of the poverty line. So we're going to do an APTC analysis. And this time we're going to include the $600 a week up until July 31st. So when we do that, we find that his FPL has risen to 173%. So this is a huge jump for him because of that $600 a week. And so under the APTC calculation, but exactly the same income, he's eligible for APTC because of that additional $600 a week in UI. So next up is my colleague, Shelby Gonzales, to talk about navigating the marketplace for immigrants and their families.
Thanks, Tara. So I'm going to cover at a very, very high level some important information about health coverage for immigrants and their families. But I've also included some key resources that provide a lot more information about the items that I'm going to just touch on. So next slide, please. So many immigrants are eligible for marketplace coverage. It's almost easier to think about who is not eligible based off of immigration status when it comes to marketplace eligibility, as opposed to thinking of all of the groups, with the different statuses that are eligible. So basically, the people who are ineligible mostly include people who are either undocumented or people who have DACA, which is Deferred Action for Childhood Arrivals program. So those two groups are going to make up a lot of the folks that are ineligible for marketplace coverage. Other people meet the immigration requirements, but they might not meet other requirements. So it's important to always think about all of the requirements when you're looking at helping somebody enroll. So for example, residency sometimes is an issue that comes up for certain immigrants. So for example, certain immigrants are here lawfully, and the standard for marketplace eligibility is lawfully present. And they are here lawfully. They might have been granted a temporary visa status that allows them to travel here, or maybe for visiting people, or just for sightseeing, or those kind of temporary nature kind of arrangements would likely not allow them to be eligible based off of their residency status. So sometimes people think, oh, wait a minute, this person, is on my list, a very, very long list of different folks that are eligible based off of their immigration status. But you really have to think about the whole, all of the different requirements. So Medicaid and CHIP are very, very different in terms of their eligibility. They're far more restrictive in general. There is a state option in Medicaid and CHIP that that allows for the standard to resemble very closely to what the marketplace standard is, but that is only for children and for pregnant women, and not all states have implemented those programs. So it's important to just familiarize yourself with the different rules that are specific to your state's program if you're helping people enroll in both of those programs. And we provide a lot of detail in the resource on the next slide, but we're not going to switch slides yet. But we do have the first resource, I believe, that we have listed there goes into great length and detail about eligibility for marketplace coverage and for Medicaid and CHIP based off of immigration status. But it is important to note, since Medicaid generally has far stricter eligibility rules for immigrants, people who are lawfully present in the US, but do not meet the Medicaid eligibility standard based off of immigration status can qualify for premium tax credits, even if their income is below the poverty line, as long as they meet all of the other requirements, of course, for marketplace coverage and PTC eligibility. And that includes things, like I mentioned beforehand, residency, but also includes things like tax filing, right? Like it has to be somebody who's planning, that can meet the requirements related to tax filing as well. It's a pretty complicated policy to think about, and similar to what Tara said, that the application systems sometimes are just not able to handle like such a complex eligibility requirement. And the one that Tara talked about is a new requirement, so that even adds to more, the more challenge. This is a eligibility that has been around for a long time, since the beginning of the ACA, yet it's so complex because it involves so many different things. Like you can't be eligible based off of state-specific rules around immigrant eligibility. Oftentimes it requires verification, it requires so many different things that sometimes it's very challenging to get the right eligibility determination at the start. And people, need extra help in understanding the process and making sure that they're completing all the documentation requirements. So we have an entire video that on our Beyond the Basics website that goes into detail about this eligibility and also about the different application processes that are associated with it. And again, I have it on the next slide. I have a link to the video that describes this. Finally, I wanted to talk a little bit about public charge, and I wanted to just mention it because I know that a lot of people have been concerned about public charge, and it's an immigration policy. It's not a health coverage policy, yet it's so interlinked because the way that public charge it defines itself, right? The way that we measure whether or not an immigration policy, whether or not somebody is eligible to have an approved application for an immigration status. There's this aspect of whether or not this person is likely to become a public charge. It's tied to a definition that looks at whether or not somebody is likely to ever qualify for Medicaid. So it is a scary concept. Things have changed very recently. The way that the policy has changed will make it extremely difficult for a lot of immigrants or would-be immigrants and their families to meet those requirements, because it requires basically people to have a fair amount of income to be able to meet the requirement. But I wanted to pause and just mention a few things that are really important right now. One is this is such a critical time that people should not. People need to put their health and their safety before anything else, right? So we wouldn't want to discourage people from accessing medical services that they feel like they need to stay safe and healthy, right, for them or their family members. So we definitely don't want people to be discouraged or scared or frightened or confused away from getting the services that they need. And then when we think about what public charge means from the perspective of enrollment in the health insurance affordability programs that we generally talk about through Beyond the Basics, which include marketplace coverage, ACA marketplace coverage I'm referring to, Medicaid and CHIP, which is generally what we focus on through Beyond the Basics. First of all, marketplace and CHIP enrollment is not factored in at all in public charge determinations based off of past rules, current rules, all the rules. It is not something that is factored in negatively into someone's eligibility determination to see whether or not they're going to meet the requirements based off of public charge when they're applying for an immigration status. Second, Medicaid enrollment for people who are 21 years, younger than 21, or for people when they are enrolled in Medicaid because they are pregnant. When you're enrolled during those different time periods, Medicaid is not going to be, the Medicaid that is received during those times is not going to be a negative factor in future public charge determination. Finally, Medicaid that is received and to pay for emergency medical conditions is also not factored in to public charge, negatively into public charge determinations. And the Department of Homeland Security has put out a notice on their website, and we link to this as well in that next slide, that they're indicating that any individual that gets any kind of COVID-related medical treatment or testing, or even if we are so lucky to have a vaccine in the future, any of that kind of care is also not going to be factored into a public charge assessment, even if the government is who pays for those services. So there's some additional reassurances that are being provided by the Department of Homeland Security, in addition to the broader kind of exception around emergency conditions that would also not be negatively a factor in a public charge determination. So we provide links around all of those things. And the last thing I'm going to say about public charge that I just want people to keep in mind is that, you know, it is a huge radical change in our immigration policy. And like I mentioned before, the result of that will be that a lot of people with low or moderate incomes are going to have a very difficult time passing this test for a variety of reasons. But the use of public benefit programs is generally not going to be what disqualifies people based off of a public charge determination, based off of how the rules have changed. And the reason why I say that is because, you know, how I talked about the restrictive nature of eligibility for Medicaid before, which is the only one of these health programs that we're talking about, right? In terms of really potentially being something that could trigger a negative assessment of public charge. When we think about who's eligible for those programs and when those benefits are factored into negatively into a public charge determination, and we think about who's likely to go through a public charge determination in the future, you know, you have that kind of Venn diagram, right? Who's eligible and who's going to get enrolled, and then who's going to go through a public charge determination, and that sliver's very, very, very tiny. Very, very, very few people are going to both be eligible and then also later on go through a public charge determination. So yes, while public charge, the way that things have changed, is going to be extraordinarily restrictive. It's not going to be because of use of benefits. And I think it's going to be extremely important to get the word out to people that this is not something that should be stopping them from enrolling and getting comprehensive coverage in Marketplace CHIP, and for children and pregnant women and Medicaid as well. So anyway, we have some additional information about that in the links in the next slide. And then with that, I'm going to turn it back over to Ina. Thanks.
Thank you so much, Shelby and Sarah and Tara. Next slide, please. So we received quite a few questions about best practices to provide enrollment assistance remotely. So we wanted to share a few resources with you, which we'll be sending out after the presentation. We have Our partners at the Center for Public Policy Priorities put together a webinar featuring foundation communities, and they discuss best practices for remote enrollment assistance. We'll send out the links to the slides as well as the handouts that they had provided. There's also a link to CMS guidance on how to obtain verbal consent, and we'll send you a link to free virtual meeting software with screen sharing capabilities, which is Zoom, the software we're using now. So with that, we will open it up to questions. We did have quite a few questions come in, so I just want to note before we dive into them, please don't ask very specific questions about specific consumers or things that are may have like private information of someone's health status. Just general questions would be best. So we'll start with a question for Tara. Should people report changes to income right now?
That's a good question. I would say yes, people should report changes in income. There are a couple of reasons. If someone's income drops and they're already enrolled in the marketplace, their income falls, they could be eligible for a larger APTC. They could also become eligible for Medicaid if their income falls, and so that would give them comprehensive, low or no cost coverage. And if their income rises, they should also report, because remember that we have the APTC, the possibility of repayment on your tax return. So if someone's income rises, they don't want to get too much APTC and have to pay it back at the end of the year. Of course, there's a lot of uncertainty in right now, and so it's really probably a best practice for people to check in a couple of times this year, especially when they have a big change like losing unemployment, getting a new job, changing their hours, all of those things, because it's just going to be such a crazy year with trying to make projections that really none of us can make. And I want to turn it over to my colleague Judy for to talk more about Medicaid.
Hi, everybody. So I think answering that question for Medicaid really requires that we learn a little bit about a maintenance of effort requirement that it is now in place in Medicaid. States were given a bump in their federal funding for Medicaid, but part of what they have to do to get that bump is keep their eligibility pretty much the same or definitely not more restrictive. And the MOE also requires that people remain and states keep people enrolled. Those that were enrolled on the date of enactment of the Families First Act on March 18th, and those who become eligible after that date will remain eligible throughout the public health emergency, the end of the quarter where the public health emergency ends, which of course we don't know when that is right now. So what does that mean for changes? Well, it didn't really change the normal requirement that people report changes that affect their eligibility for Medicaid, that people do that within a time period, usually 10 days in most states. However, changes in circumstances other than leaving the state, no longer being a resident of the state, are not going to affect eligibility. So, you know, people can remain covered regardless of any changes.
Thank you so much. Our next question is for Sarah. How does coming out of the coverage gap SEP work?
Thanks, Ina. Our understanding of how there have been some difficulties with folks accessing this, with the sisters accessing this. So the steps that we would like to sort of convey to you that hopefully will work. This is one that has to be accessed through the call center. So if you're an sister, an agent, or a broker helping a consumer, go ahead and call the call center and use the marketplace partner line and select the option for non-application driven SEPs. So if you do that up front, it should help route you to a call center representative that's like the right tier to help you with this SEP and hopefully make it a little bit simpler as you go through the process. So you should tell the call center rep that the client that you're working with you believe qualifies for an SEP because they are newly eligible for premium tax credits and because they live or lived in a state that has not expanded Medicaid. The call center person at the marketplace should then help, do the application, or if the application is already done and the person is premium tax credit eligible, the call center should be creating a ticket that should get sent to the casework team, and it should be reviewed, and an eligibility determination should be made. So we know this is like a difficult one. We get a lot of questions about it. So the best thing, that's the best instructions that we have. And of course, we will be happy to try to help if folks try to access this and have trouble. You can let us know.
Another question for Sarah. Do plans cover COVID-19 testing and treatment?
Yes, marketplace plans, all other really true health insurance plans right now are covering testing for COVID-19, treatment, not a testing for COVID-19 without cost sharing. Treatment isn't covered without cost sharing, but with the marketplace plans, because they cover the essential health benefits like hospitalization and prescription drugs and lab testing, they should have the services and the items that people need covered under that coverage. It would just be, subject to cost sharing or deductibles depending upon the plan and whether the person's getting, cost sharing reductions and that sort of thing. So, so testing should be free of charge to the enrollee, and then with marketplace plans, there will probably be some cost sharing for treatment, but much better comprehensive coverage than some of the non-health insurance that people might be seeing in the market out in the world. So short-term plans and healthcare sharing ministries and some of these other kinds of products that are not meeting all the rules and standards in the ACA, those would not be subject usually to the requirements to cover testing and to all the requirements and standards for benefits that help people get comprehensive coverage.
Great. And before you meet yourself, one more question for you, Sarah. Does a person have to have insurance coverage prior to losing their job to open an SEP?
Yeah, so the loss of other coverage SEP, it does only apply in those situations when you've actually been enrolled in your other coverage. So you had a job and you didn't sign up for coverage and then you lose your job. That does not trigger in the healthcare.gov an SEP for you. We know that that's an issue and it's a confusing issue, but it really is about the loss of other coverage. So if you're in a healthcare.gov state, that's really your best bet. The system is really structured to generally not let people who are uninsured get in after open enrollment has ended, with some exceptions. But with this one, yes, you would have had to have had health coverage before the SEP could be triggered.
A question for Tara. In a state that does determinations for Medicaid on the marketplace, should applicants not enter the $600 UI benefit if they believe they're eligible for Medicaid, or should they go directly to the Medicaid application and skip the marketplace altogether?
That is such a complicated question right now. I would say if you believe that based on income, based on monthly income, if you believe that someone is Medicaid eligible, I think the best bet right now is probably to go directly to the Medicaid application, and you would not include the $600 a week bump, but you would include all other any other UI benefits. As we said, I just don't think systems are programmed at this point, and for healthcare.gov in particular, it takes a long time to make those changes. They've got to get them in the queue. They've got to figure out how to do it. So I wouldn't rely on sort of putting all the information in right now and then hoping the program's sorted out. I just don't think that that's realistic right at this moment.
Great. Sarah, another question for you. If an individual is receiving APTCs and their income drops dramatically, but not enough to make them Medicaid eligible, can they get an SEP to pick a different plan because they'll have CSRs now?
Yes, that's a really good point. SEPs are available to people who are already enrolled in a marketplace plan so that they can change their coverage. And that is a classic case of when you would really want to make sure that someone gets into a different plan. Now, healthcare.gov does have some limitations on plan changes for people who already have a marketplace plan. So they're kind of restricted in what plan they could change to. So in that situation where someone's income has dropped significantly so that they've gone from not being CSR eligible to being able to get a cost sharing reduction, they can only get that cost sharing reduction if they enroll in a silver plan. So that SEP will let that person or that family newly enroll in a silver plan if they didn't have a silver plan already. But in a lot of cases, a current enrollee who is eligible for an SEP because of some of these changes like in their income may be restricted to choosing a plan in the same medal level that they've already been enrolled in. So that's an important thing. The system in this case on healthcare.gov does seem to take care of the limitations, so you don't have to sort of know that information. But if you see that people's plan choices are restricted, it may well be because they were already a marketplace enrollee, and there are some rules around that.
Another question for Tara. In a non-expansion state, if an individual's income drops below the poverty line, would they lose their premium tax credits?
If they report a reduction in income that puts them below the poverty line, then they would lose their APTC. Yeah. So I think it's so like I tried to emphasize, it's so hard for people to predict income for the year. I think in a lot of cases, the $600 a week bump until July 31st is going to help a lot of people avoid falling below the poverty line just because of how significant that is and how much that adds to their unemployment benefits. So hopefully this won't affect too many people, but it is something to keep in mind.
Great. And a question for Shelby. With presumptive eligibility, would that count during someone's public charge assessment if they went through presumptive eligibility for full benefit Medicaid?
So I didn't hear the whole question. So if somebody is enrolled in full Medicaid under presumptive eligibility, so they're temporarily enrolled in full Medicaid, and then, I guess, is the question really implying they might not be eligible? Is that, I'm not sure I understand. Because if somebody was eligible for Medicaid, which, by the way, in a presumptive eligibility application, somebody is attesting to being eligible for Medicaid based off of different factors, including citizenship and immigration status. So if they're attesting to that, then they're eligible during that time period, and they are enrolled in Medicaid fully. So the same things I talked about before are still true. It's very unlikely that somebody is going to meet the eligibility requirements for Medicaid, and then they would have the type of Medicaid that could later on be negatively factored into an eligibility, into a public charge assessment, because it's just the way that Medicaid eligibility is very, very restricted. So a lot of the people who do meet the qualifications, they're not going to go through a public charge assessment. And the few, a lot of the people who have, fit within that more generous eligibility, looser standards in terms of immigration status and Medicaid, pregnant women and children, their eligibility, their enrollment in Medicaid is not going to be negatively factored into a public charge assessment. But otherwise, if they fit into that narrow kind of small kind of, Venn diagram that I talked about, that there might be some people who are eligible and later will go through, but then yes, the enrollment in full scope Medicaid may be negatively factored in, but it's not the only thing that's factored into a public charge assessment. There's lots of things that must be looked at, including income and resources and employability and all, a lot of different factors.
Great, thank you so much, Shelby. So unfortunately, we weren't able to get to all of the questions, but we really appreciate you all joining us today, and we will try to review the questions and answer any that we can. So the contact information for all the presenters are on this slide. And as a reminder, we'll be distributing the materials from today's town hall via email. If you have questions or need assistance, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we'll bring this town hall to a close. Thank you again for joining us today, and be well.